Hello, ladies and gentlemen. My name is Alexandra Popova. I'm a clinical resident in the National Medical Research Center of Oncology, named after Petrov in St. Petersburg, Russia. I'm going to give a presentation announcing a research that myself and my colleagues, Kirilia Katerina, and the chief of the Head and Neck Oncology Department, Radjabova Zamira Ahmedgajivna, have initiated. So, smoking is one of the leading causes of cancer, particularly head and neck cancer. Research showed that smoking is linked to the development of over 15 different types of cancer. According to the World Health Organization, smoking accounts for approximately 70% of oral cavity cancer cases, 60% of laryngeal cancer cases, and 30% of nasopharyngeal cancer cases. Despite this, between 50 and 83% of patients continue to smoke after being diagnosed. Studies show that smokers face a 2.5 to 3 times greater risk of post-operative complications compared to non-smokers, including infections, longer healing periods, and thrombosis. Smokers have also shown lower survival rates. Additionally, smoking promotes disease progression by reducing the effectiveness of treatment, especially surgical treatment, due to impaired immunity and the body's diminished recovery capabilities. One of the reasons for the failure to quit smoking is insufficient awareness among patients about alternative nicotine delivery methods and supportive programs. These may include group therapy sessions, supplementary literature, educational videos, specialized apps, and the support of the patient's relatives and friends. Currently, alternative nicotine consumption methods, particularly non-combustible delivery systems and vapes, are becoming increasingly popular and diverse. And also, there are multiple research papers in the world currently that also study the effects of different types of nicotine delivery systems on the body and cancerogenesis and general patient comorbidity. So with our study, we have set several objectives for ourselves. The first one being the analysis of the incidence of various malignant neoplasms of the head and neck among smoking patients, the analysis of the frequency of development of complications of treatment in smoking patients. We have also set an objective to evaluate the range of nicotine products used by patients, also to evaluate the motivation of patients to quit smoking and the reasons for failure to do so. And also, we are going to try and develop ways to increase motivation and methods for easier smoking cessation. So we have started a prospective analysis of patients with head and neck cancer diagnosis and smoking history that received treatment in our medical center. So far, we have collected information on 47 patients. We use a questionnaire that consists of 3 different questionnaires, the main one being the CTUQ questionnaire, which is the questionnaire for assessment of tobacco use. This questionnaire assesses smoking habits and the history of previous quitting attempts. We also use the Fagerstrom test, which evaluates the level of nicotine dependence, helping to determine how challenging it will be for patients to quit, and the Charleston Comorbidity Index, which considers the presence of comorbidities in the overall health status of the patient, which may impact their motivation and ability to quit smoking. And then we also compare the questionnaire data and patient case histories to assess the incidence of head and neck tumors of various localizations and treatment complications, and correlate them with the patient's history of smoking. So among our surveyed population, the most common diagnosis is laryngeal neoplasms, accounting for 80% of responders. Second most common are tongue and parotid gland neoplasms, each representing 13%. Following these are oral cavity and thyroid neoplasms, with pharyngeal and nasopharyngeal neoplasms, each making up to 4% of the cases. So far, as we found out, the majority of respondents, about 88%, smoke cigarettes. And according to questionnaire, only 50% of respondents quit smoking. And studying the methods that patient used to quit smoking, we found out that 80% of those who have quit and failed to quit did not use any additional means of delivering nicotine to try and quit smoking. methods including things such as nasal sprays, patches, electronic cigarettes, chewing gums, and nicotine replacement drugs. Also, studying the motivation of our patients to quit smoking, we ask them about any psychological or alternative methods of help that they could resort to, but only 17% of respondents actually have tried such methods that could help them quit smoking, which indicated that in Russia, such methods are not very widespread. So to conclude, I would like to say that smoking, of course, remains one of the major risk factors for the development of head and neck cancer, negatively affecting the treatment and recovery of patients. Doctors' interest in targeted support for patients in quitting smoking can significantly improve treatment outcomes and long-term prognosis. Understanding the dynamics of smoking cessation attempts among patients with cancer and the types of nicotine products used can play an important role in treatment. Uh, Attending clinicians should expand their routine questions regarding patient smoking status to include the use of e-cigarettes and vaping, as they are becoming more and more widespread with each day. Much attention is paid abroad to the regulation of the production and use of electronic cigarettes and e-cigarettes, and Russia also needs to try and develop such measures to regulate these products because currently we are lacking these, and it really shows. So thank you all so much for your attention. If you have any questions, I would like to answer them.